Hello, hello, everyone. We are back again and going to talk about neurological drugs today. So I'm going to go ahead and present my screen. Hopefully you can see my PowerPoint. Let's see, slideshow, play from start. Okay, so we're going to talk about the neurological drugs. These are a little bit different than your anti-anxiety, depression drugs. Those can be neurological in nature, but they are intertwined a lot of times with circumstance as well. I don't think I talked about that as much in that lecture, but I just want to kind of tell you guys that a lot of what can happen as far as your mental health can be affected by your life and what's happening in your life. So that's why I said in that video that sometimes what people need more than anything is someone to talk to. They need counseling. That kind of thing can really help with depressive symptoms, with anxiety and that kind of thing. But there are medical conditions too, where there is something going on in the brain where somebody needs some help, whether they have low serotonin, low dopamine, those types of things that are like health conditions. It's just hard for doctors, I think, to really pinpoint what it is because the human mind is so different and so unique. But the neurological disorders we're going to talk about are more on the side of the medical, like they have to have drugs type of thing to function. And that's why I just want to make that distinction because while there are some people who have anxiety and depression and have to have drugs to function, not all of them are the case. And with these situations, with a lot of these neurological diseases, most of them are going to need some kind of drug therapy to help to bring them back to homeostasis, to bring them back more normal. So just want to put that out there first. So you kind of understand. So neurological disorders are diseases of the brain, spine, and the nerves that connect them. There are more than 600 diseases of the nervous system, such as brain tumors, epilepsy, Parkinson's disease, and stroke, as well as less familiar ones, such as frontotemporal dementia. We won't be covering all of them, and definitely not in depth, but we'll be talking about a few. So one that's popped up a lot is ALS. So that's a big one. Brain aneurysms, brain tumors, epilepsy, which is like seizures, headaches, and that can kind of span from migraine headaches to cluster headaches to tension headaches. It can be any sort of things. Memory disorders like dementia and Alzheimer's disease. Multiple sclerosis, Parkinson's disease, peripheral neuropathy, spinal cord tumors, stroke, ADHD, Psycho-Neuro disorders such as psychosis, schizophrenia, and bipolar. So the Psycho-Neuro affects the brain both neurologically and psychologically. Examples include schizophrenia or schizoaffective disorder, bipolar disorder, psychosis, and there are others out there as well. These, I would say, are conditions that really are going to need therapy at some point. I have known a lot of people in my life and in my family and my husband's family who have psychological disorders, specifically bipolar. That's one that's really common and sometimes misdiagnosed because and I'll say this, you may have the same like thought about people in your own life. But I have known every bipolar person I've known has not accepted that they had bipolar. And I've known probably 4 people close to me who have been diagnosed with bipolar by a doctor, by a psychiatrist, right? And they did not accept that diagnosis and they think that they just have depression. That's very common in people who have bipolar specifically. I think people who have schizophrenia are a little bit better about kind of if they really look at themselves saying like, hey, yeah, I probably do have a problem here. Schizophrenia is probably a lot more like serious in that those people can have episodes of like hearing voices telling them to do things, and it can be affected even worse by drugs, which is unfortunately one thing that people who are mentally ill sometimes gravitate towards is drugs to help them feel better. And I'm talking about drugs like street drugs, anything from heroin to methamphetamines to, you know, marijuana use. But anything like that can actually make it worse rather than better. But I have seen that schizophrenic people tend to kind of accept their diagnosis a little bit better, but they tend to have a harder time getting help for it and staying on medication, staying more normal, but it is possible. With bipolar disorder, these people tend to have highs and lows. So bipolar is characterized by, they'll be on a very high, and feel great and be like just, above, like, one person that I knew that had it was like working out twice a day. They were super crazy about health and fitness and wellness and just like, I mean, just on a high and just constantly like this, it's never kind of like this normal feeling. But then a few weeks later, they'd be all the way back down to low. They'd like stop working out. They would stop doing things, stop going to work, and completely be shut down from the world. And so that kind of like up and down, it's just like huge drastic changes. And bipolar can also have, along with schizophrenia, but bipolar can also have paranoia to it too. And so I've known people who are pretty much everybody I've known that has bipolar has been super paranoid about something too. So they get kind of fixated on this paranoia and what they're paranoid about. But it's really detrimental to their health. But none of these people in my life have accepted that they had bipolar. They always thought that they just had depression, like depressive times. So that can be really hard. I think that could be considered an issue with bipolar people specifically because they won't accept the diagnosis that they're getting. So they won't get the help that they need. And so that's really hard because bipolar can be treated well with therapy, seeing psychologists or psychiatrists, and also medication, but they have to be staying on it. And then psychosis is something that can be characterized in these things, but it can also be something in itself where they're just completely kind of cut off to the world, and that just looks differently with different people. I'm not going to go into that because it's just there's a lot to that, but so, and then there are other disorders as well. There's like multiple personality disorder. There's a lot of different disorders that go along with Psycho-Neuro, but those are just like the top ones that you kind of see more regularly. Drugs like Abilify, Halidol, and Seroquel can be helpful to these people. Also, lithium is a very common drug for psychotic episodes of many kinds. You might see Escalith or Lithobid as their brand names. And so that has been one that's kind of been like a tried or true drug of choice, but there are some on the market that have come out that are even better. It just depends on the person. And so that's why it's really, really important that these people are working with psychiatrists. So psychiatrists are doctors, like they've been to school for 8 to 10 years. They went to medical school and they are experts at these drugs that are out on the market and can help people with psychological disorders. So it's really imperative these people see that just because psychiatrists can also they're just a little bit less medically, like they just don't, it's not just you go into the doctor and you get a pill. Like they talk to the patient, they gain information from the patient and what they're going through, and really try to look at both the like the psychological part of it and the neurological part of it. So that's one of those things that's really important. I would say a medical doctor who sees someone with this probably should refer them out. I don't know if they do, but they should be referred to a psychiatrist for continued treatment. Okay, so ADHD, attention attention deficit hyperactivity disorder is thought to be a neurological disorder always present from childhood. It can manifest itself with symptoms such as hyperactivity, forgetfulness, poor impulse control, and distractibility. In neurological pathology, ADHD is currently considered to be a chronic syndrome for which no cure is available. It can affect 3 to 5% of the population. And medications, there's Concerta, Ritalin, Vyvanse, and Adderall. I'll come back to the medications, but I want to talk a little bit about ADHD. I do think it's overdiagnosed in America, especially in boys. As I have had a son and kind of looked at this, you know, I think they were kind of crazy about it probably in the last 10 years or maybe 10 years ago, became really crazy about it with boys, especially being hyperactive. But it's like when you have a son, you realize like they're just like that. Like it's not a, I don't think that it's a a disorder that my son is super hyper and has so much energy. It's just a thing in the males that is just common in males. And I've talked to like this is just from my anecdotal experience, but I have a lot of friends who have girls, and their girls tend to be more like spacey or like they show different signs of ADHD is what they would call it, but they're not as hyper. Girls can get hyper, but like that tends to be thought of as like a boy thing. But when they came out with this ADHD diagnosis, they talked a lot about some kids having like just like spacing out and like looking, and just like not focused on stuff. But they're not hyper. And then there's these other kids that are super hyper and have poor impulse control issues. And, so then they were like, we should just medicate them, and that became a thing. Personally, I think, and hopefully YouTube doesn't take me offline for this, but I think it has to do with drug companies that, they started coming out with a lot of these ADHD medications and they needed to sell them, and I think, I'm one of those balanced people that thinks drugs can help people and are important for some people, but I do think that they're overprescribed in general. I think that doctors get incentives for prescribing medications, and that doctors tend to try to do the best for their patients, but sometimes I think doctors are coming around this to see that like there are other alternatives besides medications, and that they should that because medications have such side effects that can be like lifelong, that it's important that they really assess if this is what the person needs. So I think that ADHD is one of those overdiagnosed things. I do think that there are cases of it, like actual cases, but I think that they need to work a little harder to diagnose them and not just diagnose every kid that's hyper, and the parents like, this is a problem. Like, yes, but also it's like sometimes common behavior in certain populations of kids. So, and there's also things like trauma that happen to children that can make children act out. There's things that kids go through, like, you have to look at the lifestyle and issues that are happening within the home too. So there's a broad thing there going on. And so I say all that to say, to kind of go down to the medications. The medications are all, they're actually scheduled drugs. They're Schedule II drugs. So Concerta, Ritalin, Vyvanse, and Adderall are the main ones out there. There are some newer ones, I think, that are updated on the list, but you'll see them. And the thing is, they are scheduled drugs. They are they're an amphetamine type of drug. And it's pretty scary, like how, young kids are being given amphetamines, like similar to something like methamphetamine that people take, in higher doses, obviously, to get high. And so I think that it's really important that doctors and parents do their research and see, like, is this something that really needs to be given to my child? Because I think giving an amphetamine to a child is like serious. Like, you really, really have to make sure that that's going to be okay, and that it's the benefit outweighs the risk. You know what I'm saying? So they are scheduled drugs. You will see them on the certification tests, so you need to make sure you know these and know the schedules. Also remember, and I said this in the pain management one a while back, but remember that scheduled drugs, that Schedule 2 drugs, remember Schedule 2, they have to get a new prescription every single time. So they cannot have refills. So that's one interesting thing that you need to know. They will always ask that on the test. They'll either ask it about opioids. They'll say something like hydrocodone, like, can you have which of these cannot have a refill? Maybe hydrocodone. Which of these cannot have a refill? Adderall, like Vyvanse, like because they're Schedule 2. You've got to know that. So remember that. Okay, seizures and epilepsy. So a seizure is a sudden, uncontrolled electrical disturbance in the brain. It can cause changes to your behavior, movements, or feelings, and in levels of consciousness. If you have 2 or more seizures or a tendency to have recurrent seizures, you may be diagnosed with epilepsy. Anticonvulsants are used to treat this condition. Oh, sorry, guys. And examples can be Depakote, Keppra, Neurontin. Neurontin also treats pain caused by shingles and other neuropathic pain. And Dilantin. So all of these are examples of what could be given to someone with seizures, epilepsy episodes, or epilepsy or seizure episodes, and are considered anticonvulsants. Okay. All right, then headaches and migraines. So this is pretty common. Probably all of us have had headaches. And they can range from mild to severe, especially if you get headaches. You're like, oh my gosh, I know. Because I've had migraines before where, I've seen the spots and lost vision and all of that. It's pretty crazy. So they can be brought on by a lot of things, which is kind of crazy also. It's hard to pinpoint what they could be because, everybody has hormone changes. Even men have hormone changes that go up and down. But women, obviously, we have hormone changes like every month, constantly throughout our cycle. So the hormone changes can affect how you, like the migraines or headaches when you get them. Dehydration. A lot of times, man, when I was a kid, I would always get, if I got a headache, I wouldn't always get headaches, but I get them kind of regularly as a kid. And my mom would just be like, you need to drink more water. If you've heard that, that's always like the response from the parents, like, you got to drink water. So drinking water is important, and dehydration can cause headaches, especially if you just haven't been drinking as much, it's hard to tell, but like your body could react to that and you're like, am I drinking enough water? Maybe I'm not. So it's always a good idea if you get a headache to drink some water. Sinusitis or cold and flu viruses can cause migraines or headaches, depending on how bad it is. If I get sinusitis where I actually have like sinus pain and pressure and I get a headache from it, like the only thing that'll help is a sinus medication, actually. I've tried to take ibuprofen and Tylenol, and sometimes that won't do anything. But like if I take the sinus drug, it'll actually take away the headache, which is kind of crazy. But that is because it was caused by that sinus pressure. Food or drink. So alcohol for sure can cause headaches in people. Some people are way susceptible to alcohol headaches. I know one thing, like champagne tends to be like one of those that gives headaches. I don't drink very often, but I remember like at weddings and stuff, if I ever drink champagne, I would get a headache later. And I don't know what it is about that, but champagne can cause headaches specifically. But there are, especially if you like overdo it with any alcohol, you probably get a headache along with a lot of other symptoms. So stay away from alcohol, you guys. But foods can also cause headaches, especially if you're more prone to headaches and hormones along with food. Like if it's during your cycle, women tend to get headaches more if they eat things like chocolate. For some reason, chocolate and caffeine can sometimes actually trigger headaches with a certain like high estrogen or high progesterone. I can't remember what it is, but they've shown a link to that. So that's interesting. But also interesting is they've shown that caffeine can actually help headaches in some cases too. So it depends on the kind of headache you have, I guess. Stress, high blood pressure, hunger, lack of sleep, fatigue, even weather changes, all those things can be caused by or can be causes of headaches. So if you're not eating enough, especially protein, your body kind of like will tell you like, hey, like I need this. And that's why I'm giving you, this headache is like a symptom of a problem going on. Some drug examples, Imitrex, especially for migraines, is a common one. Otherwise, acetaminophen, ibuprofen, aspirin, combos of these are recommended. So it really depends on what kind of headache it is because, like I said, if you've got something like a sinus problem, if you've got inflammation of some kind, a sinus medication and some ibuprofen actually might help more because it's going to take away inflammation and help with that sinus issue. But if it's something like a tension headache or, high blood pressure or lack of sleep, like something else like that, you may need acetaminophen because it will kind of dull those pain receptors in your brain. And ibuprofen may not do anything, or aspirin may not do anything for that headache. And it may be the only thing you could take is aspirin, or acetaminophen, or Tylenol. So that's headaches. When to worry. I put this in here one year when I had students. We talked about like what happens if I have like a brain aneurysm or something, and I'm like looking stuff up on WebMD myself when I get like a really horrible headache. Like, oh my gosh, am I gonna die? But most likely not, but it can happen. So headaches that develop. So here's when to worry. Headaches that first develop after age 50. So say you like never got headaches and all of a sudden you started getting them like age 50. That could mean you have something going on like high blood pressure that's undiagnosed, because that's kind of a higher or an older person thing. It could be like brain tumor or something that came up, or cancer, or, who knows, like something that, came up as you're getting older, that you'd want to get checked out. An unusually severe headache with vision changes. A lot of times this can be just migraine-like, but it's always best to ask your doctor, especially if you don't get migraines or you don't get headaches very often and you have like the worst one of your life, or you're getting vision changes all of a sudden, you're getting severe headaches all of a sudden, and you've never really had headaches and you can't really pinpoint something that's changed. Like maybe if you're sick or something, you've been sick with something. Even like COVID, I've heard COVID can give really, really bad headaches. I mean, if you can pinpoint that you're sick and that it might be that, then I wouldn't worry about it as much. It would just be a symptom of the sickness. But if it's just random out of the blue, you might want to, seek medical attention. Headaches that get steadily worse. Changes in personality or mental function. That can be a little scary, and it's like hard to tell. You may want to ask people around you, like if you're getting headaches all the time and you're acting crazy, like maybe you're like starting to lash out or do crazy things. I saw this on Grey's Anatomy, actually, you guys. It's like a patient who was acting really crazy with his wife, and his wife's like, he never acts this way, and he's just like, saying he wants to kill me or something. It was like really intense like that, obviously, because it's a TV show. But and they found out that he had a brain tumor, and so it was pressing on that part of his brain to make him like, not have like inhibitions, So I think that's a real thing though. So you may have to like talk to your doctor if you or someone like you may have to go see a doctor if that's something that's happening, because I do think that's a thing. Headaches that are accompanied by fever, stiff neck, confusion, decreased alertness or memory, neurological symptoms such as visual disturbances, slurred speech, weakness, numbness, or seizures. That could be from a lot of things, but you just want to make sure and check if like you're having a lot of those symptoms that are just really out of the blue, along with a bad headache. Headaches are accompanied by painful red eye. That's important. Headaches after a blow to the head. Headaches in patients with cancer or impaired immune systems, and swelling in the face or neck. Yeah, that's also important. So all of those things are when to worry, when to go see a doctor. Otherwise, it could just be that you need to drink some water, Okay, so that is it. I hope you found this interesting. I always find like this stuff interesting because I am interested in like medical things and just random medical knowledge. So maybe you'll have some knowledge about neurological conditions and I don't know, like even just helping out family and friends and especially when we talk about neurological issues and when we talked about anxiety and depression and just stuff like that, that you're just more aware of like treatments that can help and just be supportive to family and friends around you. And even if you are struggling with something like that, I mean, we are in a time that probably is like the hardest time for anybody, having to be online and not being able to see your family and friends as much. There's a lot of mental health stuff going on, and I just would urge that like this can bring about mental issues that maybe you've never dealt with before, or just people in general haven't. So get help if you need it, and I'm always here if you have questions. Actually, I'm probably home with my baby at this point. But I know Miss Walsh is amazing, and she's just like an awesome person, and has kids herself and so she's just like, she's a mom, and I would always reach out to her. If you need her, she will be there for you, and is just such a champion for Tab's kids. So, and really all the teachers and everybody here, but I'm just saying Miss Walsh because she's going to be, being here for you guys. So, yeah, I hope you guys are doing great. I miss y'all. Have a great one. And yeah, I'll see you later. Bye.